So thank you very much, Pastor David. Good morning, everyone. I want to do two things. One is to give a quick update, but also to continue along the theme of the subject I was covering before in terms of what do you do to protect yourself in the face of the COVID crisis. Now, it is a COVID crisis. As you know, the pandemic continues to affect people all over the world. And the protection that we thought we had in Queensland, for example, we understand now has broken because we have quite a number of cases of COVID-19 in Queensland, not very far from here as well. Luckily, in the Queensland story anyway, these cases are identified, we know where they are, and they are being actively managed and quarantined. But it does make the point of how easy this disease slips out of containment. But we're grateful to the Lord that in Victoria and certainly in New South Wales, the number of cases are going down. And they're being managed and controlled through a number of containment strategies, largely stage 3 and stage 4 containment programs. But the truth of the matter is that there is no current treatment available. So we're going to see this sporadic outbreak of COVID-19 in Australia as we are seeing the increase in COVID all over the world. Just one quick update with regard to bioprotection, biosecurity, and current treatment strategies. Some of you may have heard that the vaccine that was being trialed in England, which is the Oxford vaccine, has had a serious side effect in one of the patients who were being trialed. They came up with something called transverse myelitis, which is quite a serious condition. Now, whether transverse myelitis was caused by the drug or just happened to have occurred along the way because it is present, it can happen on its own, the trials have stopped temporarily while they are waiting on further research on the condition of that person and, of course, seeing if there are any other conditions coming up. The reason I say that is to point out that for the time being, we could be going up and down in this wave of success and failure. And it would not be a good plan to bank your entire health on the development of a vaccine. One scientist said yesterday that there is probably a higher chance of failure rather than success in achieving the vaccine. So that in mind doesn't give us discouragement, but it means that we do have to continue maintaining biosecurity principles. And I suspect that we will be having this sort of types of meetings and biosecurity control for not for this year, but certainly next year, probably all of next year, certainly until December. We're looking at possibly 16 to 18 months of this and ongoing. So I think prepare for the long haul. That's really the message. Prepare for the long haul. So quickly, as we just close up this point, what are some of the things that you should be looking at? I think we have to remind everybody that the regulation, we don't have to wear masks, but for those of you who have visited the hospital at all, you would be aware of the fact that all hospitals now in Queensland, you're required to wear a mask. So when I go to hospital now, I have to put on a mask from the time I hit the hospital door. The rules also is that there are no visitors. You have to have special permission to visit a patient in hospital. So mask, biosecurity protection, mask, and lack of visitors is certainly where we are at this stage. We don't have to wear masks in the community just yet, but if you put on a mask, it would not offend anyone. Certainly if you have a cold or cough or anything, you should not go into the community, or if you have to, for whatever reason, you really have to wear a mask. Is everybody familiar with the mask? We should all be having our own masks now. And even if you came to church with a mask, nobody would be offended. Not that you should come to church if you're sick, but if you came with a mask, nobody would be offended. So next week you might see me wearing my mask. I hope you have nothing to say about it. But it might just be to get you in the spirit of saying that masks are not a horrible thing. In Victoria, they have to wear masks all the time, wherever they go. We haven't reached that stage yet. It is recommended if you're going into a large area like a supermarket, you should wear a mask with you just for your own biosecurity. Of course, the need for washing of hands using the sanitation gels and so on is very mandatory. As it is, avoiding close contact, we still have to maintain the 1.5 to 2 meter distance. So let me just say, as I'm looking out onto the audience, that if you're not a family member here, we will ask you to make sure that you are 1.5 to 2 meters apart. Is that all right for everybody? Now, there are two reasons for that. It is a protection for yourself, but it is also protection for us, because if a biosecurity officer or compliance officer walked into the church this morning, they would come and ask the question, when they see people on the same rows, are you related? And if the answer to that is no, they will charge you and charge the church. So please, I'm going to ask you just to look around, make sure that everybody who is in a seat is related, family or close friends, so that you are allowed to stay within that distance, if not more than 1.5. Okay, so those are the biosecurity measures that we speak about. I just want to close with one thing, that over the last couple of weeks I've been looking at what can you do to protect yourself and protect your body and support your immune system. And we said that there are 7 body healers, and mentioned 2 already. Anybody remember what the first one was? The first one was the skin. Remember we talked about the skin? The need to maintain the skin in good health, and the need for vitamin D, which has been shown to protect against COVID-19. Last week we spoke about the bowel, and we said that the bowel is the most important part of the body in terms of the immune system and the things you can do to make sure that your body is in good health. Today I want to take 3 minutes to talk about the liver, which is your third body cleanser. Now, the entire, all the blood and all the toxins of the body have to be cleansed through the liver. The liver, of course, is located on the right side of your upper abdomen, and it takes the entire filtration system of the blood that goes through it. So everything that's in your blood and everything that you eat, everything that you're exposed to, the liver has to detoxify. Which means to say that the more poisons you put into the system, the more toxins that you're exposed to, the more strain you put on the liver. The more your diet is a diet that is a fatty diet, for example, you can end up with a fatty liver. And a fatty liver, of course, causes dysfunction of the liver. If you have toxins like alcohol, that people who drink alcohol, they can damage the liver, develop something called cirrhosis of the liver. And if the liver is not functioning, you can't detoxify or clean the blood, you can't clean the systems of toxins, and you will eventually die. And there are some conditions like viral diseases, like hepatitis, which causes an inflammation of the liver, and that can cause liver dysfunction as well. So the liver is a vital organ in terms of protecting your body and keeping your body healthy. And if your body is diseased, if your liver is diseased, then your body doesn't function well. Now the liver, as we just put these 2 last points, the liver has 2 reactions that are called phase 1 and phase 2. So whenever you eat food, for example, or anything that's in the blood, it's in a fat-soluble form, it's dissolved in fat. The liver has to take that fat-soluble toxin, convert it into a water-soluble compound. That's called phase 1 reaction. When it goes from phase 1 reaction, it has to go from phase 1 liver to phase 2, which it becomes water-soluble, so it goes out into the bile and gets eliminated in the bowel. Why am I saying that? I'm saying that because there are a number of things that will cause your phase 1 reactions to slow down. For example, we know that phase 1s are slowed down by caffeine. So caffeine will slow your phase 1 reaction down. It prevents the liver from detoxifying the oils and the fatty substances so that it becomes building up in your blood, you become toxic in the blood, and your liver doesn't work well. So what can we do that will improve your liver function? Number 1, be careful of the foods you eat. Be careful of the things that you drink. Anything that's inflammatory, alcohol. We do caution people about the use of caffeine or high concentrations of caffeine. These are things that can cause your liver to become toxic in a very big way, and you can't function very well. The other thing that you can do is there are certain herbs that will help you to support liver function, and I just want to give you 3 herbs that have been shown to be very successful, very valuable in both protecting the liver and improving liver function. Anybody knows the example of one? Can anybody give me one? Milk thistle. Milk thistle. I take one milk thistle every day. Milk thistle has been shown to speed up phase 1 and phase 2 conjugation. It is also a powerful antioxidant that allows the liver to detoxify itself. So we encourage milk thistle. Anybody has another one that they know of? Huh? Ginger. Very good. Ginger. Ginger has been shown to have a number of chemicals that support the liver and liver function. I wasn't thinking of that, but you'll hear of two more. Turmeric. So turmeric has the same value almost like milk thistle. It speeds up phase 2 conjugation reactions. And the other one that has been shown to also produce chemicals that support the liver is called artichokes. Anybody heard of artichoke? Yeah, artichoke has been shown to support liver function. So we encourage people to minimize the toxins, minimize the use of alcohols, particularly if you're eating a lot of fatty foods. That's not a very good thing for your liver. And you can support your liver function by milk thistle, ginger, turmeric, and artichoke. Thank you very much, ladies and gentlemen. May God bless you. And please keep healthy, and please keep safe. And God bless you until I see you next time.